Hi, my name is Niamh Daly. I am a consultant obstetrician and gynaecologist at the Rotunda Hospital in Dublin. So endometriosis is when endometrium-like tissue or lining of the womb is found elsewhere, usually in the pelvis, around the tubes and ovaries, or behind the womb. It usually affects women during their reproductive years, and it can be a long-term condition and can have significant impact on your general quality of life and health, emotional well-being, and on your daily routine. Common symptoms of endometriosis include pelvic pain or painful, sometimes irregular and heavy periods. It can cause pain during sex and can lead to fertility problems. You could have pain related to opening your bowels, passing urine, or lower back pain or pain in the top of your legs. Some women with endometriosis don't have any symptoms. And it can cause pain that can occur cyclically. So we say it can occur just before your period and gets worse during your period and then gets better afterwards. Or it can cause some women pain all the time. And you know, there's no two women with endometriosis that have the same symptoms. For some women, the symptoms of endometriosis can disappear even without any treatment. So it's so varied from patient to patient. It's a huge array of symptoms that you can get. So endometriosis can be suspected on the basis of a patient's clinical symptoms or on taking her history. If you suspect that you have endometriosis based on some of the symptoms that I've mentioned, it's best to see your GP sooner rather than later, and then they can recommend either a hormonal treatment or referral to see a gynaecologist depending on the severity of your symptoms. And if you go to see a healthcare professional with a history of endometriosis, they would take a full history from you and perform a gynecological examination on you as well, if that's okay with you. And they would also do some investigations. And the first of these investigations would be a pelvic ultrasound. This is sometimes to see if there is endometriosis on the ovaries or in behind the womb. Because if we see that, then we know that surgery might be better treatment than medical treatment. And often with these investigations, no signs are seen, no ovarian cysts are seen on a scan, but we still suspect it clinically. So we may proceed with hormonal treatment in order to see if your symptoms respond to that treatment. And if they do, then you may not need surgery. If, however, you've trialed some treatment and it hasn't improved your symptoms, or if you have been trying to get pregnant for 6 months and you feel like you may have endometriosis, surgical investigation may be required, and that would be by laparoscopy, and that's a keyhole surgery where the surgeon would place a little cut in your belly button and maybe 1 or 2 little cuts elsewhere on your abdomen, and they would have a look inside the tummy around the outside of the womb, tubes and ovaries, and they would be able to see if there are any spots of endometriosis that can be removed or treated with diathermy or burning away of the endometriosis or laser treatment. And if you, for example, were trying to conceive and you had endometriosis that was treated, then your chances of getting pregnant in the following 6 months are increased by 50%, which is really good. And the other thing to note is that sometimes we're surprised by the extent of endometriosis that we see at laparoscopy, even with a normal scan. So sometimes we can do a laparoscopy and find quite extensive endometriosis affecting the bowel, the bladder, other parts of the pelvis apart from just your gynecological organs. And sometimes it's better to not treat that in the initial surgery and to come back and have a chat about the risks of that surgery, because it might require much more extensive surgery than we initially thought. And that is a more planned, more extensive surgery, but that's very rare. So endometriosis, I always tell patients, is a chronic condition. So it may be treated or you may have surgery that will remove it, but it always has a chance of coming back. And I try to keep patients on treatments if they're not trying to get pregnant, so that their symptoms can be kept at bay even if they've had a surgical treatment. And those treatments aren't necessarily hormonal treatments. Sometimes it might just be pain medication to treat pain symptoms, but there are hormonal treatments that will work for endometriosis symptoms. So hormonal treatments that include the oral contraceptive pill or the progesterone-only pill. So it can be either one of those two. A Mirena coil can work. Any hormonal treatment that can control your periods. Because sometimes it's better to have less periods with endometriosis. You can back-to-back the pill and have only 4 periods a year while on the pill and experience those painful symptoms much less frequently. And then obviously the third option is surgery. The other treatment that we sometimes use for women, particularly if we suspect that the endometriosis is severe or if we know it's severe and we've had a look in with the laparoscopy, is a GnRH analog, and that's an injection that can put you into a temporary false menopause state with all of the symptoms that might go along with that, but it makes endometriosis very quiet. And it can make surgery much more straightforward and less risky if you've had that treatment before a laparoscopy with severe endometriosis. Endometriosis is a condition that affects women, mainly during their periods. So it's really important that we openly discuss periods, that we're able to openly say that we have bad periods to our friends and compare and chat. Because if you notice that your periods are a lot worse than other people's, then you might pick up the fact that you have endometriosis a bit sooner than you would have if you kept quiet. And I think society has a role to play in that. We need to be able to talk about periods. We need to be able to talk about the pain that's associated with them. If you feel you have symptoms that are suspicious for endometriosis, like painful heavy periods, pain with intercourse, you should see a GP and seek more information on your symptoms and pursue some investigations for that to outrule endometriosis.